Hello, and thanks for joining us today. Today, I'm going to talk with you all about the risks of thyroid surgery. If you're watching this video, you've likely talked with a surgeon about removing half or all of your thyroid gland. Surgery for thyroid disease can be done very safely, and in experienced hands, the risks are relatively very low. The primary risk that I discuss with all of my patients is bleeding. We're not generally concerned about bleeding during the operation, which is really quite minimal and under our control. We do worry about bleeding problems after surgery, however, particularly after somebody leaves the hospital. Unexpected bleeding in front of the airway, which is where your thyroid gland lives, can press on the airway, which is truly a surgical emergency. For this reason, we often keep all of our patients in the recovery room for several hours after surgery to watch for any signs of swelling. Over 99% of patients do very well and are able to go home the same day as long as someone can stay with you the night after surgery. Even though it's very rare, if there is a problem with bleeding after surgery, it's usually within the first 24 hours. If you take medicines that thin your blood, we will work with you and your other doctors to stop those safely before your thyroid surgery. The second risk of thyroid surgery is damage to the nerve that controls your vocal cords. This beautiful little nerve, called the recurrent laryngeal nerve, seen here with the red arrow, travels just behind the thyroid gland. To remove a lobe of the thyroid, the nerve has to be carefully dissected or cut away from the gland. These nerves are very small, and sometimes even moving the thyroid gland for surgery can stretch or irritate that nerve. If the nerve is stretched, that's considered a traction injury. That usually heals on its own, but it may take several weeks to months. And during this time, you may have a hoarse, breathy voice or sometimes trouble with swallowing. There's a 1 to 2% chance of that hoarseness being permanent. And if this does happen to you, there are other procedures that we have to offer that can help restore your voice function. The final risk to consider is damage to the parathyroid glands. These are tiny glands that live near the thyroid, but they have a completely different role. They control the levels of calcium in your bloodstream. Similar to the nerve we just discussed, they're very small and they're very close to the gland. They have to be dissected away when the thyroid is removed, and they're often slightly bruised or irritated during the operation. Sometimes they're so tightly attached to the thyroid that they cannot really be saved in the neck. If we can see that the parathyroid gland is attached to the thyroid that has already been removed, we can actually reimplant that tiny gland in the muscles of your neck, where it will eventually start working again. You only need one working parathyroid gland after surgery to not need lifelong calcium pills. However, about 10 to 20% of patients do need some short-term calcium supplements while the parathyroid glands recover after surgery. This can be a permanent issue. However, thankfully, that's very, very rare. There can be other complications. This can include problems with the incision, healing, or less likely, infection. These issues are very rare, with less than a 1% chance of each of those things happening. We'll discuss those risks specifically for these issues before your surgery. Thanks so much for watching. I hope this helps you understand the risks associated with thyroid surgery. Please call us if you have questions or concerns or want some more specific information. Our team would be happy to talk with you about your thyroid issues in our UW Endocrine Surgery Clinic at any time.